So hello friends, welcome to a new topic, and this time it is going to be a pretty interesting and basic one, but I think before we go on with the more medicinal aspects, this is pretty important for you to know, and because it is not easy to understand the brain and neuroscience without understanding neuroanatomy and neurophysiology. So yes, neuroanatomy is a very important part of it, and so is neurophysiology. And you can see someone's picture displayed behind me. Anyone? Who is that? It's Don Bradman, right? So Donald Bradman. But you know why I'm showing you this picture? Because this is quite relatable to many of you giving your vivas at the CNS Viscera table in your first years. Many of us are asked, okay, now tell me what is the functional area number for Wernicke's sensory speech area, and we are like, okay, 22 or 39, 40, Broca's area 44, 45, fine. And suddenly the teacher asks you, okay, do you know what areas are they called, like which scientist is named after? An instinctive answer comes out, so Bradman's area. Okay, I understand the field of neuroscience is pretty big and Bradman is a big name on the cricket field, but in neuroscience it is not Bradman. Just one alphabet can make a lot of difference. It's Broadman, right? Couple of alphabets, there's an N at the end as well. So yes, it is Brodmann's areas of functional classification of the cerebral cortex. And so bye bye to Bradman and we come to Brodmann. So functional areas of the brain. And yes, as you rightly said, they are known as Brodmann's areas. Brodmann's areas. Now, to make you well accustomed with what those areas are, we will have to take the pain of drawing the diagram of the brain. You know, it's quite hectic, I know, but then if you learn the basics of it, I think it is also not that difficult and it's quite manageable, right? So let's try the superolateral view first. You see, the basics is I'll draw two poles towards one side, that is the front side, the upper one with the frontal pole and the lower one with the temporal pole. So if I try to draw it, I'm not a great artist, but then at least something which will resemble the brain, pretty much like it, right? And the exact reverse, but we could do that later. So let's place it at a more convenient position so that we could explain stuff to you. What is this which I'm drawing? This is the central sulcus of Rolando, as you are aware. Central sulcus of Rolando. And obviously you can see the lateral sulcus over here. Okay, Sylvian fissure. But we have more to do. We know that you have the central sulcus and then you have the lateral sulcus. This divides frontal from parietal, this divides parietal from temporal. So basically, if I want to show you over here this entire thing, this is the frontal lobe, this is the parietal lobe, and this is the temporal lobe. The occipital lobe will get a better view on the medial view of the cerebral hemispheres. But at least now that we know the three lobes, can we subdivide them and make things a bit easier for ourselves? Of course we can. So this is your lateral sulcus, Sylvian fissure, whatever you say. We have two more sulci over here dividing our frontal lobe into superior, middle and inferior frontal gyri. So these are the frontal gyri. Superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. Similar thing for the temporal lobe. You have your superior, middle and inferior temporal gyri. Right? Very good. Now what do we do? Just where the lateral sulcus ends, let's extend this a bit. Just above that, you have two more sulci forming two more gyri, and they are known as the angular gyrus and the supramarginal gyrus. Angular gyrus and the supramarginal gyrus. Supramarginal gyrus. Okay. And the parietal lobe is divided into the superior and inferior parietal lobule by a sulcus. So this is the superior and these are the this is the inferior parietal lobules. So parietal lobules. Good. Let's try and draw the medial aspect as well. Right. You could just shrink this in maybe. Technology always helps you. Let's put it to good use. We would put it to better use with the labeling. So now we'll draw the medial view. The medial view where we'll see the corpus callosum. So it's just a lateral inversion, nothing else. Try to draw it as smooth as possible. Yeah, this was pretty not bad. We'll draw the corpus callosum, splenium, body, genu, rostrum, as usual. Okay, so this is your corpus callosum. You already have the central sulcus over here, extending onto the medial aspect, central sulcus. And what you need to see that you have another sulcus which is extending like this, starting from behind, and it is going like this, right? So this sulcus is known as a cingulate sulcus, and it will also come over like this. I need to extend this maybe. This sulcus is called the cingulate sulcus. It's not S, it's C, so cingulate sulcus. Good, fine. And just lying below the cingulate sulcus, you have the cingulate gyrus. So cingulate, this entire thing is a cingulate gyrus. Fair enough. Now that we are done with this, at the terminal part, just near the rostrum of the corpus callosum, we have two more sulci. The one lying outside or a bit laterally is the para-olfactory gyrus. Para-olfactory gyrus. And the one lying near the termination, this is a para-terminal gyrus. Para-terminal gyrus. Lateral one para-olfactory gyrus, medial one para-terminal gyrus. And why is it called para-olfactory? Because yes, you will have the uncus of the temporal lobe over here, and just medial to that you will have the para-hippocampal gyrus. Para-hippocampal gyrus. And in between the parahippocampal gyrus over here and the cingulate gyrus over here, you have this region, connector region, which is known as the isthmus. So this is your isthmus. And of course, then posteriorly you have the calcarine sulcus. This is your calcarine sulcus. If we start shading the areas of importance which we need to know from this diagram itself, then firstly we will shade this region around your central sulcus. Around the central, so paracentral. This is paracentral lobule, highest center for voluntary control of micturition, right? Paracentral lobule. Good. Around the calcarine sulcus, we will have the three visual centers, 17, 18, 19. So let's sketch them out. Right, so this is 17, 18, 19. There is a primary and secondary visual centers. 17 is the primary visual centers, 18 and 19 is the secondary visual centers, which are the pericalcarine 18 and paracalcarine 19, right, areas. So you have that. Did we miss something? I don't think so. Fine. Now that we have this, we come to the major part of it, that is in your superlateral surface of the brain. Superlateral surface of the brain gives you a lot. You have the central sulcus. In front of that, just in front of that, you have important areas. Which are those areas? You have the motor area, area number 4. Just behind that, you have the somatosensory area, 3, 1, 2. Then you have the association areas of the somatosensory in the superior parietal lobule, 5 and 7. Then you have the premotor area. This is area number 6. Let me shade it with a color that would be easier for you. This entire thing, the posterior part of the superior, middle and inferior frontal gyri. This is your area 6. That is your premotor area. Then you have the frontal eye field area, area 8, in the middle part of the middle frontal gyrus. Then you have 44 and 45, Broca's motor speech area in your inferior frontal gyrus. Then of course you need to have 39 and 40, which are your parts of Wernicke's sensory speech area. 39, remember, is angular gyrus. 39, remember, is angular gyrus, and 40 is supramarginal gyrus. So there is this big confusion. 39 is angular gyrus, 39 is angular gyrus, and 40 is supramarginal gyrus. 40 is supramarginal gyrus. Okay. And then you have the auditory centers, 41, 42, which are the primary auditory centers, and 22, which is a connection between the auditory input and your Wernicke's area. So you have all that in the superior temporal gyrus, right? Now it's time that we list down all of this into a table and get your concept of functional areas of the brain cleared out crystal. Come on, so we'll have this table. It's a very simple table. Right. And what do we have here? We'll have 3 columns. The name of the area, the number of the area, and the function it performs. Okay. So here we have the name of the area, the Brodmann's number of the area, and of course the location of the area. Function, of course, we can tell you, that won't be a problem when we discuss the individual lobes, the cortex, right? Maybe we'll tell you some functions as well, never mind. So we'll start with the olfactory area. Olfactory area I did not point out over here is area number 28. Okay, so you can make a note of that. Olfactory area is area number 28 and it is situated in the uncus near the parahippocampal gyrus. After the olfactory area, you have the primary visual area and the visual association areas, but I would rather call it the secondary visual areas. You can call it the visual association areas, but later on I'll teach you something else also in visual association areas. So I would rather call it secondary visual areas. There's the pericalcarine and the paracalcarine areas. So primary visual area is 17, secondary visual areas is 18 and 19. Pericalcarine and paracalcarine areas, and both of them are situated in the occipital area around the calcarine sulcus, better seen on the medial aspect. Okay. Next, after we are done with visual, we will come to the primary motor area. You know it is situated in front of the central sulcus of Rolando, right? Primary motor area is area number 4. All this is just revision, so I'm going fast. So it is a precentral gyrus in front of the sulcus, so precentral gyrus. Then you have the premotor area. Premotor area. Premotor area is area 6. And I told you it will contain superior, middle and inferior frontal gyri. Superior, middle and inferior frontal gyri. Integration of motor information. Then you have the frontal eye field area, which will help you with your gaze, or rather the coordination between what you see and your movement. While you're driving, you're seeing a car coming and suddenly you need to take a turn. That is the place where you require your frontal eye field area. Frontal eye field area will be situated in the middle frontal gyrus, as I already told you, middle frontal gyrus. Good. After we are completed with the motor system, slowly we'll come over to the somatosensory system. So primary somatosensory area. Primary somatosensory area. 3, 1, 2, right, in order, above, below. So there is a post-central gyrus. Post-central gyrus. Next we will talk about the somatosensory association areas. So somatosensory association areas. Somatosensory association areas are the areas 5 and 7. And they are present on the superior parietal lobule, as I already told you, superior parietal lobule. After the somatosensory association area, you have two very important areas which are associated with speech. You have Broca's motor speech area and you have Wernicke's sensory speech area. So Broca's motor speech area and Wernicke's sensory speech area. I'll give you a better concept with this when we are discussing aphasia, but just to make it clear to you, Wernicke's is associated with the sensory input, languages, symbols, what people tell to you, words, language. Okay, you understand what people are speaking or what is written. And Broca's is fluency, repetition, syntax, all of that. So if you have a problem with your Wernicke's area, you will be speaking, but you will not be understanding what is being asked, so you will be speaking rubbish, word salad, paraphasia, neologism, jargon. Okay, and if you are suffering from Broca's motor aphasia, then you will have a defective syntax, as if your speech is being scanned while you're speaking. So it's a scanned sort of a speech. It will be a broken speech. You'll have difficulty in expressing yourself without any difficulty in articulation, right? So that is Broca's motor aphasia, right? So Broca's area is 44, 45, and I already told you it is inferior frontal gyrus. Inferior frontal gyrus. Wernicke's area, 3 of them, 22, 39, 40. 22, already told you, where is it? Superior temporal gyrus. Superior temporal gyrus. 22 again we will find in the auditory association area. 39 supramarginal. 39 is your angular gyrus. Okay, 39 is your angular gyrus, and 40 is your supramarginal gyrus. Just to give you a quick view so that you aren't confused with what we are saying. See, 39 and 40. 39 and 40 above that. So 39 is your angular gyrus and 40 is your supramarginal gyrus. And finally the auditory areas. What are the auditory areas? You have a primary auditory area and you have a auditory association area. So primary auditory area and you have a auditory association area. Primary auditory area already told you is area 41, 42. Auditory association area is area 22. And all of them are situated on the superior temporal gyrus. Right, so this is more or less the summary table for you for the different Brodmann areas, functional areas of the brain, along with the diagrammatic representations of the same. And I hope this should suffice. In case of any doubts, you're always free. Thank you.